Hello everyone. Today we are going to discuss about an important topic in making diagnosis, which is known as taking a medical history of the patient. So we are going to dive into the topic. So actually, the medical history that is taken by the doctor actually is taking about 70% of making a diagnosis, and it comprises some a kind of subheadings actually as follows. Number one, in taking history, we have to make sure that the patient is stable, because you cannot start taking history in a patient who is not stable. So any patient who is not stable, for example, someone in a shock, someone who has a severe injury, severe trauma due to motor vehicle accident, for example, or a patient that swallowed a toxic or poison. So you have to resuscitate the patient. You have to make the patient stable, then to start taking the history actually. So now the patient history mostly, most importantly, you have to start with a biodata. Number one, you have to start with a biodata. So the biodata is abbreviated actually in the following mnemonic. Mnemonic called Nastroma. This mnemonic is very helpful. Actually, the N is for name of the patient, A is for age, then S is for sex, T is for tribe, R is for religion of the patient, O is for occupation of the patient, then M is for marital status, then A is for area, that is location of the patient. Why the age? Age, because you have since from the age there are so many diseases that can affect some age group but cannot affect some age group. For example, if you cannot suspect a kind of benign prostatic hyperplasia in a patient who is less than 30 years, you have to expect it in someone who is 45, 50 years of age. So age is very important. You cannot expect hypertension, especially primary hypertension, in a patient who is who is, for example, teenage. So unless if it is secondary hypertension. Secondary hypertension can even be seen in children actually, but primary hypertension is mostly seen in elderly. So that's the importance of age. There are some kind of diseases that affect actually some age group but cannot affect other age group. Then sex, to determine whether it is if the patient is male or female. That one is obvious, because there are some diseases that affect mostly female, while some diseases affect mostly male, like X-linked diseases actually, X-linked dominant. So that's it. Then tribe, to actually, so because to assess the culture, because some actually some patient, because in some patient you cannot perform some kind of procedures because of their cultural behavior actually. Then religion also, some also apply to religion actually. You cannot use some kind of procedure due to religious perspective. So occupation, there are some occupational diseases. For example, if someone is working in industries, you may expect him to have lung problem. For example, it is usually not uncommon to present with lung problem actually. For example, silicosis, someone who is exposed to much of silica. Example, in someone who is exposed to some kind of gases. So that is it. Then even asthma, there is occupational asthma. Then marital status, this is also very important. Then area location. This location is actually the history of location is take because to actually assess from where the patient is. Maybe you are suspecting uh, a kind of epidemic problem. For example, in China we have Wuhan. From anyone from Wuhan, we can suspect him to be maybe exposed to coronavirus. So that is the importance of taking the location actually. Then the second, that's number two. After biodata, we have the presenting complaint. The presenting complaint. The presenting complaint or chip complaint, another name. Actually, this is the essence of the patient coming to the hospital. Why the patient comes to the hospital is actually due to this presenting complaint. This is the most important actually. So, for example, the patient can come with a headache, maybe he has a kind of chest pain, maybe he's having a kind of for example, swelling, lump, so and etc. This is the reason why the patient comes to you. Maybe the patient says, today I comes to you, doctor, I'm having chest pain, I'm having abdominal pain. This is the actually presenting complaint. So that is it. And then at least, at most, the presenting complaint should not exceed 5. So actually that's it. Then number 3, we have history of presenting complaint. History of presenting complaint. This is history of presenting complaint actually. So this history of presenting complaint, you are going to take each of the above mentioned presenting complaint and expand them by asking some questions related to the symptom uh, to the patient actually. For example, if you take headache, you start asking him about when does the headache start? Why is the side? Why is the headache generalized headache or side headache? So and so on and so forth. So for you to get a thorough and a detailed history about each of the above mentioned presenting complaint is you have to use a mnemonic called biopsy. Biopsies. Biopsies are used actually. The first C is actually to characterize the symptom. To characterize the symptom. So in this you have to characterize the symptom in terms of duration, that is onset. You have to onset. When does it start? This onset means you have to ask, for example, if the patient says I am having headache as a presenting complaint, then when expanding the headache, you have to start by asking him, when does the pain start? When does it start? What are you doing? What were you doing? What were you doing when the head when the symptom occur? So that is it. This is for the onset, and then duration. For how long? For example, the patient will say, for only one day, I'm having chest pain for only one day. I'm having coughing. If it is cough, I'm having this cough for more than 3 weeks. So this is duration actually. And then you will ask him some kind of what exacerbate. What do you think exacerbate? That is what do you think make this symptom to become worse? For example, what make the headache to become worse, or what make this cough of yours to become worse, and what make it to become relieved? That is what make it to become worse. What make it to become worse, and then what make it to become better. So this you are actually characterizing the characteristics of the of each of the above mentioned presenting complaint. Now, for example, we take the headache. Then, if you take the headache, you are going to ask these questions. If you take the chest pain, you have to ask these questions. Actually, if you take the swelling, if you take coughing, but mostly we are using these biopsies actually for all the symptoms except if it is pain. This is headache, this is chest pain. We're supposed to use, there is, if you can use this, is okay, but there is a specific formula which is more easier to take history of pain. But these biopsies are usually used if the symptom is, for example, cough. Cough is not pain, like fever. So fever is also not pain, right? So, but you can, if you can, then you can use this biopsy also to take the history of any pain, for example, headache or chest pain or this is this and that pain. So that or abdominal pain. But using the other formula that I will that I will mention it in a minute. So that is the first C. Then we are going to see the second C actually. So the second C is cause. Cause, or to say progression. So what is needed here is, in this course, after you have done the characteristics of the symptom in the first C, then now coming to the second C, you have to ask him about, is your symptom becoming worse or it is becoming better throughout the days, from the day you have started experiencing this symptom to the day you arrive at this hospital, is the symptom becoming better or it is becoming even worse? You have to ask him. That is the progression. It is a symptom becoming worse, or you feel better now. That is, or it is become better. So you have to ask him, so that because you are asking him whether it is becoming worse or it is becoming better, so that to know how you will approach the treatment actually. So that is it. Then now the third C is we have complications. Complications. So sorry, before you come to the complication, we have the cause. The complication is supposed to be at the part C. This cause, right from the beginning, he tell you that I am having cough, or I am having headache, or I am having chest pain. At the back of your mind, you as a doctor, you are thinking some diseases that may cause that particular symptom of, in that particular patient. Let's say, for example, the patient is having, he said he is having cough. You at the back of your mind as a doctor, you may be thinking that that patient maybe he is having pneumonia, that patient maybe he is having asthma, that patient maybe he is having chronic bronchitis. So this, just you have to know them at the back of your mind. The moment he said that he is having cough, then for you to know that he is having asthma or he is having pneumonia or he is having chronic bronchitis, you have to be taking symptom of asthma and ask him. For example, ask him about chest tightness, because chest tightness is among the symptoms of asthma. If he said, no, I'm not having chest tightness, so just definitely rule out asthma, so it is not asthma. If he said, yes, I'm having chest tightness, so maybe it is, maybe started thinking asthma. So for example, if he said he didn't have chest tightness, so definitely it's not asthma. Then ask him about, did he has fever, because definitely pneumonia should present with fever. If he said, yes, I'm having fever, so maybe you'll be thinking about, if he said he has fever, you have to ask him about the fever is low grade or high grade, because if it is high grade, it is pneumonia. If it is low grade, maybe it is TB. So at the back of your mind, you are going to be asking him, actually asking the patient about the symptoms of the disease that you expect are the uh, cause of the symptoms of the patient actually. So that is it. So now we have the complication. That's the part C. Complications, because some diseases actually can have complications. Definitely, some diseases, there are the complications that bring the patient to the hospital, not the symptoms. Because some patient may actually resist coming to the hospital. They cannot come to the hospital because of actually normal simple symptoms, maybe cough. They will not come to the hospital unless if they have complications. So, for example, if you can take disease that have complications, for example, malaria. Malaria can have can cause symptom of, for example, kidney problem. Then just ask him about, if you if, for example, the patient says he is having fever, and you are expecting that the patient is having that fever due to malaria, just ask him about complication of malaria. Ask him maybe, for example, are you having trouble with urine? How about the color of your urine? If the color of the urine change, for example, becoming reddish, so definitely he is having kidney injury, and that is among the important complications of malaria actually. So that is ask him about the complication of disease that you expect the patient to be having. For example, another complication of anemia is of malaria is anemia. Then ask him about symptom of anemia. For example, in the symptom of anemia we have fatigue. Then just ask him about, are you having fatigue? If he says no, so definitely there is no symptom. There are no complications of that malaria that you are suspecting. So these complications, they need to be asked, because to actually know how to approach the complications, because after you treat the disease, you have to manage the complication also to limit the damage, right? So that is it. And also uh, another, not only malaria, but even any disease that, depending on the symptoms the patient present with it. So that is it. Then the last C is caregiver so far. Caregiver, maybe at home. Caregiver, you have to ask the patient, so what have you done about this symptom of yours? Have you taken medicine, or have you take anything? For example, he may tell you that, yes, I went to the chemist man, then chemist person give me some kind of aspirin or some kind of paracetamol and then take. Because why are you asking him this is because if the patient is having pneumonia. Pneumonia, we know it is having fever, right? So if he took paracetamol at home, so definitely he will not present with fever. So you are asking him this to know that whether he has tried something at home. So that's key given so far. That is the last C. So now this is how you take history of presenting complaint. Now we are going to continue number 3. After the history of presenting complaint, you are going to ask him about past medical history. Past medical history. So past medical history, actually you are going to ask him about whether he is having the same symptoms before, maybe in the last weeks or in the last, even through his entire lives actually. You will ask him, have you ever had this cough before? Or if he presents with cough. If he presents with, for example, let's say chest pain, you will ask him, have you ever had this chest pain before? If he said no or yes, you have to document actually. So, and also you have to actually ask him about actually some kind of specific chronic diseases which are abbreviated as MJ threat. MJ threat. After you ask him whether he's having the same illness before that he presented with to you with to the hospital. After you ask him, if he said no or yes, then you have to document. Then proceed to ask him this question. Have you ever, these are constant, you have to ask, every patient you have to ask him this, especially if he's old patient or that is it. So, for example, this is myocardial infarction, MI. This is jaundice. This is TB. This is hypertension. This is for R. This R is rheumatic fever. This is actually epilepsy. This is asthma, and then anemia. This is diabetes mellitus. So you have to ask him this. Every patient you have to ask him about these diseases because they are chronic diseases, because they are most